Well, hey everybody, this is Robert and welcome to Outbreak News TV. And in today's news brief, we're going to take a look at the measles outbreak in the Philippines. Well, the country has now logged more than 1,800 cases of measles from January 1st to April 13. This is 5 times higher compared to those reported during the same period last year, according to health officials. Data from the Department of Health Epidemiology Bureau showed that last year during the same time, 374 cases of measles were logged in. Now, DOH spokesperson Albert Domingo said cases increase when there's an increase in numbers of gatherings among children, especially during the summer, he explained. Earlier, the World Health Organization said rising measles cases is a global concern and not exclusive to the Philippines, since unvaccinated children in many countries increased because of lockdowns during the COVID-19 pandemic. The Bangsamoro Regional in Muslim Mindanao, or the BARMM, recorded 48% of the total number of cases nationwide, which resulted in a declaration of an outbreak of the disease in the area. Now, the Philippines Department of Health has implemented the measles response outbreak immunization in the BARMM since April 1st. The department aims to vaccinate 1.3 million eligible children against measles nationwide. Since measles is caused by a virus and not by a bacteria, Domingo said it calls for symptomatic treatment or cure for the symptoms, which include high fever, cough, runny nose, and watery eyes. Rashes appear about 3 to 5 days after the first symptoms, he added. What's alarming, among kids, measles can become pneumonia, which is fatal, and another case of encephalitis, which is a medical term for swelling of the brain. Now, we don't want these to happen because the survival rate among these children is very low, according to Domingo. Measles, mumps, and rubella, or the MMR vaccine, may be given to children with a minimum age of 12 months. 2 doses of MMWR are recommended, with the second dose usually being given when the child reaches ages 4 to 6. However, it may be given at an earlier age with at least a 4-week interval after the first dose. Now, this increase in measles in the Philippines has prompted the CDC to issue a travel advisory. And this is from the U.S. Embassy in Manila. And it says actions to take. All travelers to the Philippines, including infants and preschool-aged children, should be fully vaccinated against measles, according to the CDC immunization schedules. If you are not sure whether you or your travel companions are fully protected against measles, schedule an appointment to see your healthcare provider at least 1 month before traveling so you can have enough time to get vaccinated. Some people should not get a measles-containing vaccine or should wait. If you don't think you can safely receive a measles-containing vaccine, talk to your doctor and consider making alternative travel plans. Okay, and let me go ahead and close with this. This is a global map of all the outbreaks of measles going on around the world. And right now, the CDC is monitoring and issuing travel health notices for 51 countries, the Philippines being one of them. In fact, there's 2 in the Western Pacific in which there is a travel notice, and that is Malaysia and the Philippines. But as you can see, Africa, a lot of the Middle East, Europe, and the Indian subcontinent are all battling measles outbreaks. Okay, well, if you like the video, please go ahead and subscribe to the channel, like the video itself, comment below, share with your friends, and I'll see you next time on Outbreak News TV.